Breast cancer is the most common cancer diagnosis among women in the United States. The rate among young women is on the rise. That's according to the CDC. That's why a group of medical advisors has updated the mammogram screening guidelines to start at the age of 40 instead of 50. The U.S. Preventive Task Force strongly recommends women ages 40 to 74 be screened every other year. It says these critical screenings can reduce the risk of dying. It could save your life. Let's bring in Dr. Frita Fisher, a medical expert in nephrology medicine and pediatrics. Good morning, Doc. Thanks for joining us.
Good morning, Hannah.
So is this considered a win for women, updating the screening guidelines from 50 now to 40? There's a huge difference in that decade, as you well know.
There is a huge difference. It is a win, but we need to win more. So while the U.S. Preventive Services Task Force has previously, in 2016, recommended the screening be between ages 50 to 74, other societies like the American Cancer Society, the American Society of Radiology have already had their recommendations starting at age 40, because we know that, of course, breast cancer is a leading cause of death. It's the second most common cause of cancer death. Lung cancer is number one. But also, 1 in 8 women or people born as women will have breast cancer in a lifetime. And since 2015, the number of women in their 40s getting breast cancer has increased by 2% each year. And so this is actually long overdue, but it's a win. However, they're saying screening should be every other year, but many societies, including the American Cancer Society, recommend screening every year in the 40s.
The big question here, doctor, is what's driving the increase in this breast cancer diagnosis in these women that seem to be getting younger and younger?
There are so many things. It could be environmental. Certainly it's genetic. And then with some of the better screening tests we have, like the 3D mammograms, perhaps it's just being detected and perhaps it was there all the while. At any rate, the science is showing us that definitely the numbers are increasing. In young women, the numbers are increasing. So certainly with this change in guidelines, we can pick up more cancers, and it looks like we can save at least 20% more lives.
The question I wondered as soon as this news came out just a few hours ago is, will insurance pay for this? Because that's a challenge for a lot of these women, is getting their mammograms covered by insurance. Now that we have these guidelines, will this continue to be an issue?
Yes, and actually, the insurance is required to cover Tier A and Tier B recommendations from the U.S. Preventive Services Task Force, and this is a Tier B, and so insurance will cover it, at least for the every other year. My concern is that for those of us who recommend for our patients to get screening every year, will the insurance cover it every year? And I'll tell you, there's certain groups at risk. Of course, yes, the older you are, the higher your risk of breast cancer. If you have a family history, if you have some of the genetic markers like the BRCA gene, but also if you are a Black woman, you are more likely to get diagnosed at more aggressive stages of cancer. And Black women are 40% more likely to die of breast cancer than white women. And so my question is for these high risk populations, will they be covered? And really, it's a matter of advocacy. It's important for women, even if your insurance doesn't cover it, talk to your physicians, advocate for yourselves, because oftentimes you can get a pre-authorization and get the screening and get protected.
I'm so glad you mentioned the discrepancies of women of color when it comes to breast cancer. Dr. Frita Fisher, thank you so much.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.